Welcome to Atlas Pain Relief Centre. My name is John Williams. I'm the Clinic Director of Atlas Pain Relief Centre, and we have a website called www.sacroiliacjointpain.co.uk. We also have a Facebook page called Sacroiliac Joint Pain, where you can get some banter and some conversation about your particular problems if you wish to discuss it, and it's a forum base, so people can actually come and join it and see if we can help you out. Okay, today we're going to be talking about sacroiliac joint pain, the causes, and some of the things that are offered to you as the reason why you're having these problems by various practitioners that you may visit. Okay. Firstly, one of the things I would say is that you probably do not get offered tissue causing symptoms. So whatever the practitioner you visit, they're usually unable to tell you what particular tissues are causing your pain. They may have a theory about why you're getting the pain, but they generally can't tell you what is the cause or the pain generator. So it's all based on theory, okay? And depending on where you did your training, will depend on what kind of theory that you have. So you've got different schools of thought depending on where you did your training, what experience you have, and also any research that you may have done in the subject. So that will influence your kind of your thought processes on trying to provide a reason why people are getting this particular problem. So some of the people you may visit are going to be doctors, GPs, surgeons at a later state probably, PTs and physiotherapists, chiropractors, osteopaths, and perhaps massage therapists as well. You may well visit people like acupuncture who may well try and help you with the symptoms, but to actually look at the causes, those are a group of people that are most commonly used as a referral source to try and solve your particular problem. Okay. One of the things which is used an awful lot is the word hypermobility, or the word your pelvis or your joints are hypermobile. And one of the professions, well, a couple of professions to be fair, would be chiropractors, osteopaths, physical therapists, who are saying that the reason that your joints are misaligned or coming out of place and keep moving too much is because your ligaments are slack and you are hypermobile, okay? Or your pelvis is hypermobile, or your sacroiliac joint is hypermobile, right? Now the word hypermobile, it is a syndrome. You can have hypermobility syndrome, but this would affect multiple areas of the body and other joints as well as the pelvis. So that is a disease which is, I would say, there are people that have got it, but it's not a common reason why people visit chiropractors and osteopaths. But they will say to you, you're hypermobile, okay? You're hypermobile, it's moving around too much. And so what we're going to do, we're going to correct it for you because it's come out of place. We've popped it back for you, or we've adjusted it for you. And the next time that it happens, which could be virtually straight away or the next day or something, it's back out, you go back and visit your chiropractor or your osteopath again, or your physical therapist, and they'll go, oh, it's come back out again, we need to do this again. Okay, it's because you are hypermobile. You have to start looking at this with some skepticism, because the fact is that the more they manipulate it back, allegedly back in place, the more hypermobile they make it. Because what they're doing, that when you do an adjustment or you're doing a manipulation, you stretch the ligament slightly. You take it to the joint to its barrier and you take it a little bit further. So that's going to have an effect on loosening that joint. So it seems crazy to me to say that somebody's hypermobile, and the reason why we're doing these manipulations is to try and correct something. You're just going to make them more hypermobile. So there's a whole industry being generated about this theory of hypermobility, sacroiliac joint belts, okay? People giving exercise prescription for to try and strengthen the joints up or strengthen the area, to toughen up. Prolotherapy injections to toughen up the ligaments and shorten the ligaments up to stop this hypermobility. Everybody's focusing on hypermobility. Personally, I don't buy into it. I don't buy into it at all. It's generating lots of income for lots of people, but if you examine people who come in who have been told they're hypermobile, they're not hypermobile at all. Okay, I'm not saying it doesn't exist, because women that who have been pregnant and have had the hormones relaxing introduced into their bodies to relax the ligaments off to assist with pregnancy and the baby passing through the pelvis, then they will likely to be hypermobile, and they are, you know, a group of people who may well suffer from some form of hypermobility of some of the joints in the pelvis. That's probably, you know, the only instance I can see where this is likely to happen. It shouldn't not happen, obviously, in men. So what we're looking at then is perhaps that hypermobility is much overused, and we should look for another reason why people are getting pain, because being hypermobile in itself is not going to give you pain. And so what is the pain generator? They haven't got an answer for you, but they will say something is out of place, something's been stretched, something's this, something's that. It's all theory. So what we're going to look at in another video is we're going to be talking about potential treatments to help you with your sacroiliac pain, because I'm sure there's so many people who are in pain who are fed up of listening to all these different theories and really want something that's going to really help them. We'll talk about that in the next video, but for those people that are visiting all these different practitioners, getting all these different conflicting pieces of information, saying that you've got this, you've got that, you've got the other, no wonder we end up eventually giving up and visiting surgeons and saying, look, you know, I've got all this hypermobility, it keeps coming out, it doesn't matter what happens, you know, it seems to be happening all the time, I'm spending loads of money, I'm in loads of pain, please, can you fuse my pelvis? Can you stop this hypermobility from happening? And a whole industry has been generated around iFuse and other kind of fixations of the pelvis, where they're actually screwing and fixing and fusing the pelvic girdle, which for me is absolutely the wrong thing to do, unless obviously it's indicated through either trauma or something like that. But for those people who are just being told that they're hypermobile and they perhaps are not, it's a really scary thing to have your pelvis fused, because it's something that's supposed to move, and you cannot say that our maker who designed us has designed us for this pelvis to move in those particular points. The two sacroiliac joints and the pubic symphysis are stress relieving points in the pelvis, and they're not designed to be fixed. They're designed to move, and they're supposed to move to relieve stresses. So if you actually fixate these particular areas, what's going to happen is you're going to get referred pain somewhere else later on. You know, you might get some temporary relief at the moment, but you will get some pain later on. So we'll talk about treatments in another video. Thank you.